When using Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution, a healthcare professional will administer it through an injection into the affected eye, after numbing the eye. Following the injection, you will be monitored in the doctor's office. The frequency of injections will be determined by your doctor, but usually, the first 4 doses will be given monthly, and then the schedule will be adjusted as needed. It is important to follow your doctor's instructions for the best results. Using this medication regularly will help you get the most benefit from it. If your condition worsens, be sure to inform your doctor. If you experience any eye irritation or discomfort, it's important to let your doctor or pharmacist know. It's also important to remember that the benefit of using this medication has been determined to outweigh the risk of potential side effects. While many people using this medication do not experience serious side effects, it's crucial to inform your doctor if you notice any floaters or blurry shapes in front of your eyes. In addition, it's important to seek immediate medical attention if you experience chest, jaw, or left arm pain, unusual sweating, weakness on one side of the body, trouble speaking, or confusion. This medication may also rarely increase the risk of developing serious eye conditions, so it's crucial to seek medical help right away if you notice any pain, redness, sensitivity to light, or vision changes in the affected eyes. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, make sure to contact your doctor or pharmacist for further guidance. Before using Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. It's also essential to discuss your medical history, especially if you currently have an eye infection or swelling. When using this medication, be aware that it may cause blurred vision, so it's best to avoid activities that require clear vision, such as driving or operating machinery, until you can do so safely. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or planning to become pregnant, it's crucial to talk to your doctor about the potential risks of using Faricimab-Svoa. Your doctor may order a pregnancy test before starting this medication and may recommend reliable forms of birth control while using this medication and for 3 months after the last dose. If you become pregnant while using Faricimab-Svoa, it's important to speak to your doctor right away about the risks and benefits of continuing this medication. It's uncertain whether this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using Faricimab-Svoa. When taking Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution for your eye condition. Always consult with your healthcare provider for personalized advice. If you or someone you know has taken too much Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while residents of Canada can reach out to their provincial poison control center. It's crucial to act quickly in cases of overdose to ensure the best possible outcome. It's important to undergo medical tests, like eye exams, while using Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution. Make sure to keep all your medical appointments and consult your doctor for more details. This medication has been specifically developed to treat certain eye conditions and should be administered as directed by your healthcare provider. Remember to follow their instructions carefully for the best results. If you happen to miss a dose, it's important to consult your doctor for a new dosing schedule. This medication, Faricimab-Svoa 6 mg per 0.05 ml intravitreal solution, is typically administered in a hospital or doctor's office and should not be stored at home. It is used to treat certain eye conditions and should be administered as directed by a healthcare professional. The dosage and timing of administration will be determined by the healthcare provider based on the individual's specific condition and needs. It is important to follow the healthcare provider's instructions closely and to attend all scheduled appointments for this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.